Thank you, Dr. Smith. There's a well-known quote by the Dalai Lama that illustrates the impact of philanthropy very well. Just as ripples spread when a pebble is dropped into water, the actions of individuals can have far-reaching effects. I now have the distinct pleasure to introduce you to three remarkable people whose partnership will have a ripple effect on understanding the social determinants of health through the inaugural Margaret Crotty and Rory Riggs Clinical Chair in Nursing, which has been awarded to Northwell's Chief Nurse Executive, Maureen White. Thank you guys for being here tonight. So Margaret and Rory, let me begin by saying not just thank you for being here tonight, but thank you for your support of Northwell and this endowed chair that we're going to talk about. You are both deeply invested in Lenox Hill Hospital, and now you've established a first of its kind at Northwell. This endowed chair is very special. It's perhaps one of just a few in the entire United States, and it'll further our mission in health equity research throughout nursing. Why was creating this chair in nursing so important for you?
Oh, I will go. Maureen's obviously a huge part of this and what her vision is, but to me, that nursing is 25% of the employee base in Northwell, and anything we could do to get them recognized as being sort of the heartbeat of the whole organization is just really an exciting moment for us.
It was also really strategic, I think, and when you think about two of the biggest priorities, quality of care, and the nurses are the backbone of the quality of care metrics that we have, and that's why the magnets are so important. But also, Northwell's all about its people, and the nurses are, represent all of the richness of all of the different kinds of diversity that we care about. And it's also women leadership and at its finest, and so that meant a lot to us.
Congratulations on being named. You're the inaugural Margaret Crotty and Rory Riggs Clinical Chair in Nursing.
Thank you very much, Brian.
It's, I know from us talking quite a bit about this is an exciting opportunity for advancing nursing at Northwell. You've spoken about how important nursing is to our population health efforts. How will this endowment make a difference in the nursing workforce's ability to help the underserved populations that we serve?
Absolutely. This endowment will make a tremendous difference. I want to start, though, by extending my heartfelt thanks and deep appreciation and gratitude to both Margaret and Rory for establishing this endowment. It means so much to me because it really embraces all the reasons why I went into healthcare, to help those that can't help themselves, to help those that are perhaps not as advantaged as many of us, and to be able to supply support to those individuals. This nursing, when it relates to this endowment and nursing in general, over the centuries, nursing has had a rich history in public service and in public health initiatives. And this endowment will allow us to continue that rich history and build upon it, focusing on not just general populations, but most specifically for the underserved and underrepresented populations. During the pandemic, we all have seen, unfortunately, in too much detail, and just how underserved and underrepresented populations suffered the greatest during this time. With this endowment, we will use these funds from this endowment to heighten our knowledge in the effects of social determinants of health on the health and health outcomes that we see in these populations. So it is just enormous, the things, when I look ahead of the things that we can do with this endowment due to your generosity. It's just heartwarming to me, and again, I cannot thank you enough for this opportunity to shine this light on the important role that nursing plays in healthcare, and to give us this opportunity to make a difference in the populations that we serve. So thank you so very much.
Thank you. I go off script, but I do remember as we started to work towards accomplishing this wonderful gift, and you guys told me that you were going to do it, and I let Maureen know, and I don't remember the exact words, but I think it was, you just made my career or something like that. So it was pretty profound. Yes. Let me put it that way. And it's a big deal, because as you said, Margaret, and I just want to reinforce that, to have the chief nurse executive in an endowed chair in an academic organization means something to all 19,000 of the nurses. It means a lot to the organization. So let me reaffirm that gratitude.
when we first started talking about it, 2020 was the year of the nurse, right?
Yes.
And then the WHO extended the year of the nurse to 2021, and Rory's like, let's make every year the year of the nurse.
There we go.
I'll support that.
Yeah, well, we'll give you opportunities for that in the future. So, Margaret, you have devoted, as we heard earlier, much of your life's work towards tackling challenges of health and education inequities and their effects on children and families. You've had a pretty remarkable impact locally and globally as well. How did you choose this path? Why are you so passionate about it?
It's always humbling to talk about this in places where Northwell staff are, but I think I'd start with sort of the public health approach. It's really interesting and inspiring. You can identify a problem, you can try, you have a hypothesis, you try solutions, you test them, you evaluate, you measure, and then you scale what works. And that's a really good answer, except that I think really at the end of the day, it's because all of this, the healthcare and people and inequities and disparities, it's all about relationships with people. And it's all about the way we show up in the world and how we can contribute both to the causes and the solutions of all these inequities. And so at the end of the day, it's about relationships. It's about getting to know people and really about your own self-reflection. And so I've just found it to be so rewarding. And in any job I've ever had, I know that I've gotten more from those relationships than I've ever been able to give. And I think, just to put a finer point on it, that's what nurses do every day.
Good point. Rory, just to follow on, that we talked about Margaret's interest, but I do know that as we talked about this at dinner one night, it was pretty meaningful for you as well.
He's been a patient.
I'm not a patient, but it's kind of self-evident. If you're 25% of the workforce, you have a different view of healthcare than everybody else. And so this whole idea that Maureen has of doing the study on social determinants of health is totally a nurse's view. The totally view of the people who come in every day and you see every day and realize that the healthcare isn't about one big thing. It's really about a blend of these patients who come in every day. And it's really just inspiring to hear you talk about it.
Thank you.
Well, I want to follow up on that, Maureen. So you started to get into this a little bit, but a lot of this conversation is about the social determinants of health and making sure that someone's zip code doesn't really determine what happens with them. Can you talk a little bit more about how this is going to be connected into that space?
Nursing is built on those relationships of really understanding where an individual is coming from and trying to address their needs and their concerns and their wants and their wishes. And we hear that, the nurses will interact with those patients on a continual basis and learn what seem to be little tidbits, but important elements that could help us to drive their treatment regimens, understanding of how compliant they might be able to be in those treatment regimens, and altering that course to make sure that we're providing them with the best opportunities for wellness and health as we go along. So we'll use it to further educate our nursing workforce, both on the inpatient and ambulatory side and home care side, and really break down those silos between those three and have them look at healthcare as a continuum of care. It's really just pretty much never the fact that people are ill because they just don't care. They do, but they may not have had the wherewithal in order to receive the kind of health care that they needed or wellness opportunities that they should have. And so nursing, through the education, will educate our nursing workforce. Through their observations and their interactions with the patients and their families, we'll gain a greater understanding of their social determinants of health. We'll be able to collect that information and that data, dissect it, understand it better, and to help us as a health system determine how can we enhance and improve the cares and services that we provide to these various communities, and how can we enhance their welfare, their health and welfare as they move forward along that continuum. I think that's so important because, as you stated, no one's health and wellness should be determined by their zip code, by their education, by their socioeconomic background, or by their ethnicity. We are better than that. We need to focus on those things to make sure that doesn't happen.
Please, Rory or Margaret, as we talk this through, it's so clear that your objectives are completely aligned with your own personal interests, which is where philanthropy really is a beautiful thing. What were you going to say?
I just didn't want what she just said to just stop there, because what she just gave you was just this brilliant description of how to do a clinical approach to social outcomes and how to look at it from a nurse's point of view, because the nurse has this so totally unique point of view to be able to take these measurements. And it was just great to hear you say it now. I've heard it a number of times. But
and also the nurses know what people are going to have when they get home, and what kind of care and what kind of environments they'll be, which is so central to the outcomes. Right?
Yeah.
They're the only people who know sometimes.
Yes.
But I think this endowment gives them the opportunity. It highlights for them that what they see, what they believe should be different, that we can make a difference, and that we have the support of individuals such as yourself through this endowment to say, it's time. It's time for us not just to hide. And many times what happens when we interact with patients and we learn that they may not have anybody when they go home to cook for them or to provide them with foods, many times people don't know, because it's not something that we go around boasting about or want to get recognition for. It's just what we believe in our hearts are the right things to do. Nurses will go to patients' houses and cook food for them, or bring them in food, or that they believe will help them in their journey, or make sure that they have the medications they have. I think this endowment highlights that for the nurses. There's something bigger than us, that we can do it, but we're a large part in making sure that that information comes forward and coming up with the action plans on how do we improve that. So again,
you're talking about the kind of care we all want.
Yeah.
Part of your vision is diversifying the nursing workforce, I know. Can you talk a little bit about that? What's the objective there, and how you see that as an impact on the people that we serve?
Yeah, I see this as a twofold focus area for us. By diversifying our workforce that is more reflective of the patients, the populations, the communities that we serve, I think there will be a greater connection to their caregivers and the care providers, to get a better understanding from the patient's point of view of what they believe they can and can't do, and how we can alter that care plan to make sure that they are in the best position possible to achieve their health and wellness. But I also think, on the flip side of that, when we talk about social determinants of health and the socioeconomic positions that many in underserved and underrepresented communities are in, many of those individuals, they too, just like all of us, have dreams and aspirations. And so with this endowment, we hope to create, our plan is to create educational opportunities to provide to these various communities what opportunities are out there in healthcare and nursing particularly, to spark their imaginations, or to fuel their drive to want to go into nursing or into healthcare. But when you've never done it before, nobody in your family has ever gotten through high school or grammar school even, you don't know how to do that, to navigate those roles. And also to provide them with the financial support so they can achieve their dreams and aspirations in life. And so it's one of these gifts that gives for generations to come, and we can't underplay that notion of helping others. My parents always taught me that the greatest legacy any of us can leave is to help those around us achieve their goals, dreams, and aspirations in life, and watch them flourish. And as I sit here and talk about that, I have goosebumps, and I'm reminded of my childhood and growing up, and always being taught, always look out for somebody else. It's not always about you.
That's profound. Thank you. Wow, we talk about impact, and you guys are seeing what the impact's going to be of this gift. But you Margaret, you've got these incredibly important leadership roles that you've taken on. Thank you, at Northwell. But both you and Rory have been supporters of Lenox Hill and Northwell for a good period of time now. Can you talk a little bit about what that's about for you and why?
Well, first of all, we live on the block of the Greenwich Village facility, so it's very close to home for us, and I think, when we think about the healthcare that we can access and the things that we care about, Northwell really cares about all of those things. And I've often said this, that 201, everybody at Northwell cares about that patient. And you could say that about a lot of health systems, but really Northwell has a heart. And I think the way you describe your work, I think the way that we're putting so many resources into community health and community partnerships, the scale and size and scope and diversity of the system, we can do really wonderful things there, and that's starting. And so it's just been a really inspiring journey, and even in the short time that we've been involved, it's changed and it's grown, and it's the people that are getting involved and taking notice, and it's the nurses are just they're no longer the unsung heroes, and I just think that's
No, they're singing.
I know, you got my joke.
Exactly right,
but I think that it's just been so fun to be part of that, and to be welcomed in also as a partner, and not just be watching from the sidelines, and to get to know the scientists and the doctors and all of the people that are in the hospitals, and most especially the nurses. And then I think the last thing I'll say is we have both been patients, and so to be able to be part of the family in another way is really special. As our whole family is, we've all been patients now in Northwell.
Can I tell a little story? I love the story.
Please
I
do.
was at a healthcare conference, and Michael had just spoken.
Oh yeah, nobody wanted to follow him.
And the heads of, I won't say the name, but one of the major health chains in the country stood up and said to the whole audience, nobody wants to follow that guy. And really, the leadership Northwell's had during our time here has just been amazing to watch. And I think we're totally excited to be part of it. And that's kind of what drives us, is the notion of the leadership of Northwell, how much we've watched it unfold just in the little time we've been supporting the organization.
Thank you. That's great stuff. In either setting here, we both have what I would call the mic drop, so thank you. Maureen, congratulations again on being named the inaugural Margaret Crotty and Rory Riggs Clinical Chair in Nursing. Rory and Margaret, thank you again very much. Margaret, congratulations on being the incoming board chair. I look forward to a lot of fun with that. Thank you both. Maureen, thank you.
Thank you. Thank you both
Maureen.
very much, really. From all the nurses at Northwell Health, this is a very big deal, and something that I just can't tell you. It came at the right time, at the to lift everybody up. It wasn't just the voices of the nurse choir that lifted it up. When this was announced, there was cheers all around. That nursing was recognized by both of you in this very profound way. I can assure you, we will not let you down.
Thanks.
Thank you.
Thanks, guys. Thank you.